Great. Thank you, Jessica. So welcome everybody today to our webinar called Moving Toward Resilient Schools. We have a couple presenters for you today. And so starting off, I'm just going to introduce Sue Mackey Andrews. And she is a co-facilitator from the Maine Resilience Building Network. And she has worked practically her entire life in pediatric and early childhood. And so not to delay, I'm going to turn over the presentation to Sue right now to begin today.
Thanks, Joy, and you'll handle the controls, right? Because I'm not able to do that right from here.
Yeah, Jessica has the controls, Sue, and if you need her to move a slide forward, you can just say forward.
Okay, so on behalf of both the Maine Resilience Building Network and the Centers for Disease Control and Prevention at DHHS here in Maine and AdCare, thank you for joining us today. I know that your time is precious, and we appreciate having you with us to listen and learn about what's happening in a couple of schools in Maine in response to their information and knowledge and hard work around adverse childhood experiences and the promotion of resilience in their school. These slides were developed by both the Maine Resilience Building Network and our partners, who you will hear from shortly, Waterville High School and RSU 34. And so we ask that you not duplicate or use these materials in any formal manner. And if you want to think about doing that, please get in touch with us at maineaces@gmail.com, and we can talk about how to give you permission to do that. So Jessica, the next slide is a graphic on the pair of ACEs. And, you know, since probably 2012, 2013, the Maine Resilience Building Network has been doing training throughout the state with a variety of partners in healthcare, social work, education, behavioral health, as well as at the community level, early childhood, to talk with folks about the science of adverse childhood experiences and what they mean here in Maine and in our local communities. And so we largely talk about ACEs as being what's happening for the child according to the science from birth to the age of 18, which was the period that was measured. And these are things that happened to the child at that time that might include living with a parent with maternal depression, or living with physical or emotional neglect, a household where there's domestic violence happening, where they've lost a caregiver due to parent death or divorce or separation, living with a parent or a caregiver, and sometimes with another family member who has a substance use disorder or perhaps may be incarcerated. And so there are a variety of adverse childhood experiences that, according to the initial study that was done in the mid-90s by Drs. Felidi and Anda, that really start to tell us how these experiences can affect us for our lifetime in terms of particularly our health and well-being. And some of the science that's emerging even more so now are the other pair of ACEs, which is the adverse community environments or experiences. And we can think about the different communities that we live in. For rural Maine, this often translates into isolation, maybe poor housing or substandard housing, could be community violence, or the lack of community resources that are available for families. For Maine, I think that one of our most significant adversities is the reality of poverty for so many of our children and families throughout the state of Maine. And certainly we can look at the lack of opportunity, whether that's educational, economic mobility, the opportunities that afford people to move ahead and to achieve in life in ways that they desire. So these are challenges that come together for people, not just in the birth to age 18 period of time, but we know that during the prenatal period as well, that's what's going on for that fetus in the womb. In the maternal host is also having an impact on that child's developing brain. And we know that adversity just doesn't stop at age 18. Adversity is something that most, if not all of us, are going to deal with throughout our entire lives in one form or another. And this next slide is the ACEs pyramid, the original ACEs pyramid, which illustrates to us sort of the potential trajectory of adverse childhood experiences that many of us, actually 2/3, if not more of us, have had adverse childhood experiences in our lives. And for some people, that has resulted in arrested neurodevelopment, some developmental delays, some health conditions. And we know that when left unattended, that ACEs can still bother people and still can result in early death, sometimes 15 to 20 years prior to their cohort group. And some of the new science, you'll see epigenetics on the left-hand side. Epigenetics is the way in which experience and the, sort of the social determinants of health, which may be considered the adverse community experiences, affect us. Not that they change our DNA, not that they change our genes, but they change the way our genes connect and link with each other and form the DNA. And so if you think back to your high school biology and the recessive and expressive genes, it changes the order in which the genes express themselves. And we also know that there is intergenerational transmission of trauma happening in terms of domestic violence, poverty, war, etc. And just appreciating, I think, that these experiences, for most of us, do not last a lifetime. They do not have a long-term impact, but for some people they do. But for all of us to have that caring person in our lives to help to support us during times of challenge and stress, to help us cultivate that resilience, which we know is the antidote to adverse childhood experiences. So let's get into a little bit of the data if we can. And you'll see the map that's on slide 10. This is a map of the Child and Adolescent Health Measurement Initiative, which otherwise is known as the CAMI. And this is done every couple of years nationally. This is a telephone interview that's completed with parents, asking about a whole lot of family factors, including what's happening with kids. And you'll notice Maine there up in the upper right-hand corner is white, as are 11 other states. And what this means is Maine is one of 12 total states in the country with some of the highest ACE scores that are seen in our youth in our United States. And this moved appreciably from the CAMI that was done 3 years ago. So our ACEs did increase from the period of about 2013 to 2016. And the next slide summarizes some of the impacts on children when ACEs are not interrupted or addressed. And so we can see that unaddressed ACEs can have the impact of not helping children being ready for school, having difficulty managing their own behavior, soothing themselves, interpersonal relationships with peers and with others. And that can extend to adulthood in terms of forming long-lasting interpersonal relationships. And certainly we know that many of our children are entering school with fair challenges and having difficulty both with school engagement and success. And this can last throughout the grade levels. So for many public schools, this is becoming an increased challenge and something that they're really wanting to learn more and pay attention to. So let's get into the My House data a little bit, the Maine Integrated Youth Health Survey. And let me share with you that this is a survey that is done every other year on the odd year. So it was just completed in Maine in 2017. And it asks students at the high school, middle, and 5th and 6th grade a variety of questions about health and well-being and safety. If you haven't had the opportunity to look at these data, all you have to do is Google MIYHS and you'll find the data. It's available by health district or county. And if you're in a school district, you can talk with your principal or superintendent about getting the information from your school district or your school. So in addition to a variety of other health indicators, in 2017, this was the first time that we included the ACEs questions. And just know that these questions were written to mirror, although not absolutely, many of the questions in the original ACEs study that was performed in the mid-90s. We did not ask any questions about parental substance abuse or poverty. And it's also important for us to note that this survey is voluntary on the part of the school district. And so there are some school districts who do not complete the study. And also that the ACEs questions do appear towards the end of the survey. They were not in all 3 of the surveys that were distributed, so not all schools have these data for their individual buildings. That will be remedied in 2019 by the CDC, though. The ACEs that were measured in Maine largely reflect the national study, where the first 2 talk about the loss of a caregiver, either through divorce, separation, or death. I'm having a little bit of trouble seeing here. Having a parent who is in jail or incarcerated, living with a parent with mental illness or depression, having a parent who often is swearing at you, insulting, or humiliating you, putting you down as a child, or the implication of physical harm within the home. There are also 2 proxy questions that have been in the My House survey for quite a while, and one is on sexual assault. Were you ever forced, either physically or otherwise, to have sexual contact? And also the exposure to domestic violence at home. Has violence in your home ever made you want to leave, etc.? And so what we saw on slide 15 is the data from this first time in Maine to the 8 ACEs variables, the 8 ACEs metrics that were asked about. And what it illustrates is that just about 1 in every 4 Maine high school students have at least 3 of these ACEs that were asked about. And you can see the chart where there are many children without any ACEs at all. So it's important to understand that not all children experience this, and some children experience them to more of a substantial degree than do others. It's also important to note, because of the modified number of questions that were asked, the students were asked just to say how many of these things had they experienced, not specifically what they had experienced. So that's an important qualifier to these questions. The next slide will illustrate to you the varying degrees of ACEs in the high school population by county. So you can see that Waldo, Piscataquis, and Washington County reported the highest ACEs amongst their high school students. But really, when you step back and you look at all of the counties in Maine, having at least a quarter, if not more, of your students experiencing 3 or more ACEs is something that we should all be very, very concerned about. Slide 17 talks about the difference according to some of the demographics of the students who were asked questions about their adverse childhood experiences. And we see that females are far more affected by ACEs than are males. And this would be also representative of the national survey that was done at Kaiser Permanente. And we can see also that kids who report that they're LGBTQ plus students experience a higher level of ACEs than do heterosexual students. These are all things for us to be aware of, and as you drill down in the data at the local level, to really think about your community, the demographics, and how children may be experiencing things differently. Joy?
Great, thank you, Sue. So we've divided the webinar up today, and we're going to listen to a few of schools or districts who are addressing ACEs. And so first up today is Sherry Brown, and she's a passionate advocate for trauma-informed schools at Waterville Senior High, and she's been there for over 6 years, where she served as the founder and chair of their ACE committee. She's taught high school English for 15 years in Maine and Colorado, and has also worked as the director of first-year initiatives at Thomas College in Maine. She is currently a doctoral student in prevention and intervention studies at the University of Maine, focusing on trauma-informed schools. And just a little bit about Waterville Senior High School. So they have approximately 500 students. They're located in Kennebec County. Currently, they're part of the AOS 92 district, which includes schools in Waterville, Winslow, and Vassalboro. But next year, there's supposed to be a dissolution of AOS. And so Waterville will again be part of just Waterville Public Schools. The district is also made up of 3 other schools, an alternative education program and an adult education program, and the district's EduCare program. And so I'm going to turn it over to Sherry to talk about their efforts. Thanks, Sherry.
Thanks. Hi. Can everyone hear me? Are we good? I think. So, yeah, as Joy said, and as Sue kind of pointed out, we've been feeling exactly what Sue was talking about in terms of ACEs in our schools, but we didn't even know what ACEs were. So I guess I'll start back our journey. I've actually been at Waterville for 8 years, but our ACE work started about 6 years ago. And that was around 2012. But prior to that, you know, our staff had noticed that our population, there was something going on. We definitely, Waterville at the height of its school, you know, at the height of population of the school had about 1,200 students, and we're down to about 500 now. Our poverty rates have been rising, as we can tell by our free and reduced lunch rates, and so staff started to notice some differences with students. And so they had done, you know, prior to 2012, there had been a book study on a framework for understanding poverty by Ruby Payne. An attendance review committee had been set up, you know, an at-risk committee had been set up, and still, you know, and then in the fall of 2012, I remember it vividly because I was driving in my car and I heard an NPR podcast. It was an NPR story on This American Life by Ira Glass, and it was he was interviewing Paul Tough, the author of How Children Succeed, and there was a student that was talking about just some of her experiences, and that's where I was introduced to the term ACEs, adverse childhood experiences. Light bulbs went off. I think I started crying in the podcast. If you see me, I'm usually pretty vivid jumping around. I was crying. And I immediately emailed our assistant principal and principal and said, we need to read this book. This is what's going on with our kids, which kind of sent us on this journey that same year. So this was 2012, 2013. We brought in speakers for, you know, our professional development. So at the time, Pender Macon was at the Real School. She presented information to us on trauma in the brain at a faculty in service. We also had a MELMAC grant going on for those who know about that. That is with college and career readiness, where we had, as staff, started to get in front of we have community home rooms where our entire school population comes together. And we had started presenting stories about staff in terms of grit and resilience. And then in the 2013-2014 school year, we brought in Dr. Anne Jennings from the Anna Institute, and she was a guest speaker on ACEs. And I remember in the staff meeting, so at this point, awareness was risen. We knew we knew about ACEs. We knew how it affected students, as Sue had just talked about. And one of our faculty members stood up, and he was holding, you know, some of the paperwork, and said, "We get it. We know this is affecting our kids. Now, what do we do?" And we all just kind of stared at each other because in 2013, 2014, it was pretty new. You know, we're kind of even though Waterville is considered city, it's still a pretty rural district. So I started to do some research and kind of came across helping traumatized students learn from the TLPI, which is the Trauma and Learning Policy Initiative in Massachusetts. I had a long talk with them. They said, you know, high schools really aren't doing a lot of this work. It was, you know, we were like, what do we do? The book talked about, and it's, I have a picture of it that I'll show you in a bit, but stay on the slide. You know, then serendipitously, our alternative ed director brought in Mackey Andrews, thank you, Sue, into our office, and it was like the heavens opened, and we partnered with Mervyn, who had started to do professional development for schools. And so for our entire faculty, we did 2 professional development days, one in March and one in May, and so that's the following year in 2014, 2015. And there was an ACES summit, and then it was called Bring It On, which was about strengths and resilience for our faculty and staff. We also, our steering committee, which, by the way, I walked around and I made sure, and as I talk about kind of what we learned, I made sure we got representation from every department. We had also had our KBH counselors. We have a partnership with KBH Counseling, that she was part of our committee. Our school resource officer was part of our committee. We had administration, guidance, every department in the building to talk about, what can we do? So we still were kind of flying blind, even though we were with, we had been trained by Mervyn, but not a lot of schools in 2014 and 2015 were really talking about, how do we help, especially high school kids, because a lot of the social and emotional learning programs that go on are in younger ages in elementary schools. So we started to do some things as a staff, like, for example, for any educators there, remember Smarter Balanced, the year we had it, and I'm an English teacher, so I remember it well. We felt that the added stress on our juniors, especially thinking about ACEs and trauma, may be too much for them. So we did because they're not only taking Smarter Balance, they were also taking the PSAT and the SAT, so they were kind of tested out. So we, had created stress bags for them. We gave them anxiety tips. We cooked them breakfast served by the faculty. We created a poster campaign where they're still hanging in our rotunda with inspirational quotes that talk about resilience, that that we shared once a quarter. And this is again 2014, 2015. We also recognized that we needed to partner with the community members. And so through Mervyn, we were able to get Paper Tigers, the movie, which I'm sure if you're involved in the ACE world, you might have heard of. And if not, you can stream it on Amazon. And Paper Tigers is a movie about an alternative high school that started to look at a trauma-sensitive focus. And so we had a showing at the Waterville Opera House. We partnered with Mervyn, with Colby College, with Thomas College, I think, the Waterville Opera House. There were tons of partners. We had 150 people come to the showing. We ran a kind of question and answer session after, and it was pretty amazing. And then 2015, 2016, we thought, well, part of what we noticed with our families, as Sue mentioned, we have so many families that are dealing with so many horrific problems and troubles. And we started to notice that our open house that we held in the fall was not being attended very well, and by the parents that we really felt we needed to see. And so we instituted an open house roadshow where we take our open house to different areas in the community. So we held it, if you're familiar with Waterville at all, down one of them, we held one year at the South End in Waterville. Then we held one the following year, in the North End on North Street. We've also had it at Head of Falls. And so which has been nice because we've noticed kind of an uptick in families coming from different areas that would not step foot in a school for, many reasons. So we also, in 2016 and 2017, we said, okay, now where are we going with this? What are we doing? And our ACE committee, which has around 15 to 20 members, depending on the time of year, met twice over the summer to kind of plan what we were going to do. And we came up with, and I'll show you in a bit, we came up with a mission statement, and we came up with some goals that we wanted to work on. We also recognized that our staff was burning out. And I think when we start talking a little bit in a couple of minutes about challenges, we weren't taking care of ourselves as staff enough. We started to really recognize the struggles our students were going through and not really focus on how that was affecting us. One cool thing we did during the 2016-2017 school year is we held something called a Resilience Day, where we took a half day. We brought in a speaker who's done a lot of ACE work in the state, and if you have a chance to, you should contact her, Dr. Elise Pratt-Ranco. She's out of UMF. And she came and presented about ACEs to our students, and then also, but mostly resilience. And then we had all kinds of activities that the students could take part in. We had everything from spas in the library. There were therapy animals. We had kickball and ultimate frisbee. We had a ton of activities that students were able to do. We also held a community showing of resilience, which is the kind of partner to Paper Tigers. It's an hour-long movie that is more technically based. That Mervyn, as a partner with Mervyn, you can kind of talk to Sue and help set up some screenings possibly. We took 10 members to a workshop with Dr. Ken Ginsberg. I'll talk about him in a second. To a Reaching Teens workshop where we were presented with some materials that we utilized some. And then also in the 2016, so last year, we we finally, as a community, got a drug-free community grant. And so that's not just with Waterville, but Waterville, Lawrence, Messalonskee, I think Winslow, all the areas received a grant. And through that partnership, we've been working and received some funding. Woohoo, for the first time we had funding. And they were able to set up focus groups for us of students and faculty to kind of look at where we could go from here with what we need to work on. We also did some other, like, good luck on finals, where we handed out personalized pencils that said good luck on finals. We had a barbecue, we had a photo booth. And then we started to do more parent outreach because, as Sue mentioned, we've also noticed a lot about the community and what the community really needs, that it's not just ACEs and the student, but we have adverse experiences in our communities as well. So then fast forward to this year, which wasn't that fast, I apologize, but there was other stuff too we did. But this year, we also kind of stuck with the same goals because we felt like we hadn't really reached them, and we formed some subcommittees to, some that have done well and some that have not. The best subcommittee that we have actually is we formed with that partnership with Healthy Northern Kennebec, a student resilience group for the first time, and they are really kind of organizing and getting their show moving for next year. Their name is GRIT, which is Growing Resilience in Teens, and we were able to, thankfully last year, hire a social worker for the first time. And so our school social worker, as well as our health teacher, lead that student group. And we have about 22 students, which is huge, who are in GRIT. And their goal is to kind of help students become more aware. They also, so next year our plan is to bring in NAMI and do a mental health first aid. And NAMI's willing to, typically their training is for 18 years old or above, but with our student group, they're willing to go for 16 years old. So for our students who are 16 years old or above, will be trained in mental health first aid. And then also our faculty and staff will be trained that way as well. We've also done, I guess, well, let's go to the next slide. We've done a lot, but I want to talk about, so if we can go to the next slide, the mission and goals of our committee. So we came up with 2 years ago this mission for our ACE committee, which we need to rename it. We've been talking about, but with everything going on, with proficiency-based education, and I'll talk a little bit about all the things in education that kind of get in our way sometimes. We're sticking with ACE committee for now. So our mission is working with the entire WSHS community to create a trauma-sensitive environment that builds awareness, communicates strengths, fosters connections and encourages us to expect the best and stay for the worst. And we felt that that sort of encompassed what we wanted to do, how we wanted to work with our students. And then there were 3 goals that we're working on. We worked on last year, this year, and I'm assuming we'll probably work on next year as well. First, that everyone in the school should have knowledge of what ACEs are and how they possibly affect our lives. Second, everyone in the school should learn how to cope with the effects of ACEs and become more resilient. And we called it kind of taking the resiliency reins. And then finally, to create a positive, supportive community of faculty, staff, parents, students, and the Waterville community. So if we go to the next slide, we can kind of talk about what we've learned. So one of the biggest things, and that I think is important, especially as Joy mentioned, I've started doctoral work up at Maine because I was so passionate about this. I said, we've got to see where the science is with this, that we need to have some sort of evidence-based trauma-informed model. We in education often kind of jump on bandwagons. We think something sounds good, it sounds like it'll probably be good, and then we institute it before we really know what the implications are. And what's so scary about trauma is that there's a really high possibility of re-traumatizing students and traumatizing teachers. And so we talk a lot about being pretty careful, like what do we do to make sure that we don't do that? So when we're looking at, you know, as much, the problem is that there's not a ton of research out there yet because this is pretty new. Schools are kind of finding this on their own because they have to, because of everything that our kids are going through. And yet we don't have the research to kind of say, is this working? Are we doing what we want to do? Hopefully that will come in the future. But anyway, some things we've noticed. Leadership is key, that it needs to be a whole school approach, that we need to focus on school climate. And the focus shouldn't be on the ACEs, especially with kids, because that's so, it feels so hopeless. And it's not. You know, as Sue mentioned, that there's the reason that we're in this work is because with this awareness comes this possibility to change. And so the focus needs to be, especially with kids, on resilience and strengths, and that we really notice that we need to include our families and communities, which we started to do more. So there's some pictures on that screen of some different, and I'll point to the IES, the What Works Clearinghouse. That's out of the U.S. government. It's awesome for any, and those are the best evidence-based practices out right now. Reaching Teens by Ken Ginsberg is on the left. That's a huge curriculum. We found it very overwhelming in terms of it's not really a step-by-step guide, but more pieces that you can include while you're looking at trauma and resilience. Also, there's the National Resilience Institute, that the TLPI that I mentioned earlier, Helping Traumatized Children Learn, is over on the right. We also have, and I would call it more trauma-informed than not trauma-informed, sorry, evidence-informed rather than evidence-based, the Trauma-Informed School. That is by Jim Sporletter, and he was the principal in Paper Tigers. It's an awesome model, and looking at it, there's a lot of great things. It's not totally tested yet. So again, like I said, we don't know. And PBIS, which is kind of in the center of the screen, Positive Behavioral Intervention and Supports, is used a lot in elementary schools, especially some middle schools. High schools don't use it a ton, but there is some. And that's meant mainly for behavior, but there are also PBIS. It's a multi-tiered level of support, which I think is hugely important. There's a PBIS model that includes trauma-informed for schools. So if you Google that, you can also find it. So if we go to the next slide, now quickly, I'm going to wrap it up here shortly. I guess what we learned the most is that in order to sustain change, you know, we need to think about, did we miss a slide? I felt like there was a model. Was there one before? Nope, before. I should have like a 3, nope, before it. Yep, that, sorry. This is what we really noticed is important. So evidence-based, the strong self-care component, and then implementation science to make a trauma-informed school. So this model really is what I wanted to point out. Those are the 3 basic things we learned, and also to work with communities and schools. So now we can go to that last slide. Sorry, yep, there we go. So this is implementation science, and you can go to the National Implementation Research Network. There's a ton of awesome resources. They have something called the Hexagon tool, where you can kind of see how to make sure that your implementation works. This is actually from a study that looked on how do you make your, like if you're trying to implement something, how do you make it last? Because that's what happens. We all get, in schools, something's great for a year or two, but how do you sustain that change? And that's where we are really working right now. And so these 7 things, leadership, vision and culture, infrastructure, resources, actually planning your implementation, continual professional learning, and then incentives creates a sustained change. And so we're working towards that right now. But I guess that's all for me. Back to Joy. Joy?
Great, I'm here. Sorry, I took a little bit for my phone to turn green. Thank you, Sherry. Next, we're going to take you to, and that should say RSU 34. I'm not sure why it says 13. I'm going to introduce you to Jennifer Goodwin, part of RSU 4. She has a bachelor's in psychology, and she's spent the last 16 years working in social services. In her current position, school community coordinator, and she's been in this position for just over a year. Just a little RSU 34. They serve Old Town, Alton, and Bradley. They have 5 schools, 3 elementary schools, a middle school, and a high school, and they serve about 1,500 students in their district. I'm going to turn it back to Jennifer. Thank you, Jennifer.
Okay, thank you. You can go to the next slide. I'm going to talk a little bit about how this kind of got started. Penquis started a couple years ago. They had heard about community schools and wanted to bring it to Maine, and Senator Millett was a big proponent as well. So they went to legislator, and they had people come in from community schools and present to some of the school districts and some senators and legislature, and talked a lot about this. It's LD 956, an act to create community schools. So here it says, oh, hold on, my computer's beeping at me. A community school is both a place and a set of partnerships between the school and other community resources. Its integrated focus on academics, health, and social services, youth and community development, and community engagement leads to improved student learning, stronger families, and healthier communities. So our guidance counselor, Vicki Wilcox at the elementary school, met with Renee at Penquis, and they kind of got together and started talking about this. And Penquis had kind of tried to reach out to other schools, and there was a couple that had responded, and we actually ended up being the only ones that applied. So we got to be able to be part of this grant to try and bring community schools to Maine. And I wanted to kind of show the community school model, but for some reason I couldn't get it to get on a slide, so technical difficulties there. So I put the website up, communityschools.org, which has a lot about their framework that they utilize when putting community schools together. And so a lot of that is, a set of partnerships that you bring into the school when you assess where your needs are in the community and in the school. And we do have a very high needs in mental health with our students, substance abuse issues with our families and our students, high instances of that. We see a lot of poverty in students coming in saying they're hungry. It's in, a lot of times we have been asking like the question, well, what do we do with all these students? And we have teachers that were feeling burnt out. So this year has been a pretty interesting year because, I just started last year. Things were kind of like a learning, and it still is kind of like a learning experience for me. But so some of the things that we have started, I'm going to go into that. You can go to the next slide. Let's see. Next slide. Look. All right. Oh, I feel like I'm okay. So food insecurity and poverty, that number has actually gone up. This was last year's data. We actually had more students kind of come into our district last minute, and we see that a lot of transient students. So these are some of the things that we've been trying to work with our food insecurity and poverty. We started community gardens last year, and that has been a blessing. It is amazing to see how many beds we have. We started with 12 raised beds. We added, 8 more, even higher raised ones for people who have difficulty with disabilities and things like that. And then we have another 10 out in the back. So our garden has grown into this massive program, and our teachers are utilizing it. They're taking their students out there and they're showing them the garden, and they're learning in the garden, and it's become like an integrated part of our school. And in the summertime, we're able to utilize what we grow to give out to families. And this is going to be like our biggest one now, because we started a school pantry this year. And so we're utilizing that to give food to families. So we're able to get them to come in and get this fresh food straight from the garden, straight from, and we also ask them, to come and volunteer. We do have some families that come and volunteer in our gardens and everything. So other things that we do, we have a summer lunch program. I know there's other places around the state that do something similar, and that is we have different sites where we give students free lunch. And so we have a park. We have several sites. There's 2 parks in Old Town that we go to. We deliver food to the YMCA, the rec department, 2 of the housing authorities, and another apartment complex in mobile home area. So we do that. And during this summer, I'm actually going to be doing a weekly produce distribution. A lot of community outreach is going on this summer. I'm going to be doing a weekly produce distribution at a different site each week to get fresh produce to families every week. Just because we were noticing, especially today, I did my first pantry opening with no school in session. So I wanted to see how that went. And I only had about 5 families show up, which is really low number. So I'm hoping that in doing this and getting the produce out there and doing the community outreach, that we'll get more families involved, and we'll be able to, spread that out a little bit more to amongst the families in the area. So a lot of the partnerships that we have is through the University of Maine, the United Methodist Church, Good Shepherd. We did get a partnership with them. So for any of you that have been questioning about whether or not you want to do a school pantry and how to do that, really, you have to look at your free and reduced lunch rate. It has to be over a certain percentage. But looking at who you can partner with, it can be a nonprofit or a religious organization like a church, and we partnered with the United Methodist Church. And then once we did that, we were able to get our partnership with Good Shepherd, because our free and reduced lunch rate was very high. And so with that, you get free produce. So we can do monthly produce or bi-weekly produce or weekly produce distribution, which is really helpful. I find that every week I do, when school's in session, I do grab and go produce bags, and they are a huge hit. And you don't question who takes them. So we reduce a lot of the stigma that way. And we have kids, and sometimes you can see the staff going, well, because they know that those families don't necessarily need the food, but they really want those apples, So, I let them take a couple, just because I want them to feel that it's okay, that they take it, and it's not just for, just to make sure that stigma is kind of reduced a little bit. But we move a lot of food that way. And then families who aren't comfortable coming into our pantry can get food and not have to have that, talk to someone or show that, because they are afraid of that stigma. So those are some other things that we have done for that we're working on. Our partnerships with the Methodist Church and Good Shepherd has been huge in that. And it's really, really just a wonderful program. And the food you can buy through them is fairly inexpensive. And we found that a lot of people will donate. If you open up an account with Good Shepherd and you start talking to people like Hannaford or other local organizations and banks, they really want to help, and they really want to donate money to that. So I've found so far that our overhead cost for ordering hasn't been a lot, because we've had so many people donate money or food to us for our pantry. So it's really, we are really a food-driven society. So it's helpful in that sense. Okay, we can go on to the next slide. All right, so mental health and substance abuse. So, and some of this is all what we do for our students. So we have like what we call the stuff that matters every year. And usually what we have is panels, and we talk about substance abuse. We talk about healthy relationships. Sometimes we talk about, the students kind of choose their what subjects they want. So we've talked about hate speech and bullying in the past. But the main ones that we get a lot for is substance abuse and relationships. So we've partnered with Partners for Peace to come in and talk to our students about healthy relationships. And they're wonderful about that. We've partnered with Acadia to talk about suicide prevention and how to take care of yourself. Bangor Public Health has come in. They have wonderful substance abuse programs that they come and talk to our students about substance abuse. And so we also have something called BAR, which is building assets and reducing risks. And what we do is our staff in 6th, 7th, and 8th grade, and I think 9th and 10th grade in the high school, they meet weekly and they talk about the students and they look at where they are academically, behaviorally, those kinds of things. And then we have something called risk review, and they have certain students that they're like, we need to put them on risk review. Okay. And when we have students in risk review, we do a weekly kind of plan for them, and we do weekly check-ins, and we talk about how they're doing, where we need to put more support for them, those kinds of things. And it's been wonderful. With that, and I don't have it on here, we started River Runners this past year, and that's for some of our 7th grade students, and it's kind of like a mentoring experience for them. And we have a person that works with a group of 7th graders on various things. They do service learning projects and activities that build on their relationships and builds up their social and emotional development, which has been really good for some of our students. And we're looking to expand that next year. So keeping our fingers crossed that it all goes well. We're looking towards finances and stuff like that, but it was, I guess, from what I've understood, it's been a very successful first year. We also do restorative circles just in the middle school, but those have been really great. We did a health and wellness week or a couple, like last month, and in each grade we did a circle after every time we did. They went through suicide prevention. We went through the healthy relationships. We did, I'm trying to remember all the topics, and I can't off the top of my head, but at the end of all their sessions, we did restorative circles, and we talked about how they were feeling, how the days went, what do they want to hear more of. And, we got a lot of feedback from our students about what they wanted more of, and and a lot of it again was dealing with relationships and how to have healthy relationships. And they also wanted more health education, which is, you hear that often from students, but they have a lot of questions, and it's really powerful to have those, and they don't mind talking in those circles, and they really put a lot of effort and input into them. We have mentoring through the Bodwell Center, 2 days a week at the elementary school and at the middle school, and that is through the Big Brothers Big Sisters program, and that has been really helpful for some of our students that need it. We've partnered with them for a few years now, and that's through the University of Maine, and it's been great. And that will continue, and most of the students keep, as long as the University of Maine student is there for, at least 4 years or whatever, they stay with that student for the full 4 years that they're in college. I mean, we have a couple that will have to change every now and then, but they're pretty good about it. They really like their mentors. Okay, go to the next slide, please. All right, these are just some of the youth services. After school programming, we're trying to bump that up a little bit. And we're looking towards trying to add a homework club for that. And because we do tutoring, we offer tutoring through the Black Bear Tutors at the University of Maine. And we want to bump it up to try and make it so we can have more students involved and have a better program involved for them. But again, that's finances, that's hard to do. But if we can bump up our after school programming with the partnership that we have with Good Shepherd, if we can get it so that we're, a few days a week, we can also start offering to feed our students dinner, which is huge because we all know that with food insecurity and poverty, those kinds of things happen. And they might have breakfast and lunch with us, but they go home and there's no dinner. So, having that option will be a really big thing. So these are some of the things we do. World of Work and career fairs every year to get students thinking about what they want to do, what their future was going to be, and talk a lot about it with them. Like, these are things that you can do, and talk about how they can get there, and what they've done, how they can continue with their future, and really try to boost that in them, that they can go further, and there's all that stuff out there for them. And it isn't just doctors and lawyers and things. We've had we had somebody come from the University of Maine that showed them slides on things that they were doing with cancer research, which was really cool. The students really love that. So we have a variety of things. We have theater coming and talking to them about that, so the students can really think about all these different things that they can do. We can continue on. So what we've really come up with now is the Resource Center. And we decided to call it the Resource Center, even though it's not a center yet. That's a bigger dream for me. But people ask me, so what's your center like? And I'm like, well, it's a closet. So these are some of the things that I do with the Resource Center. And a lot of it is, like I said, this summer is community outreach, because I want more people to become involved in what I'm doing and understand what my part is. So this summer, I'm doing a lot of that community outreach in the community. Like this past Saturday, I was at the Old Town Housing Authority giving out fresh produce to families and talking to them and hearing what they have to say and what they need. And we've had a lot of success being able to kind of point families in the right direction, and be able to check in with them afterwards and say, so how did that work for you? And like recently I helped a mom get in touch with Pine Tree Legal over some stuff, and I saw her at the Resource Center, and I asked her, how did that work for you? And we got to talk about it, and and how what I gave her for advice and what I gave her for some services and some support was really helpful for her, and she's getting what she needs, and everything's getting taken care of the way that it needed to be. So that was really nice to hear. And it's really great place for families coming in and going, and I can check in with them, and it's been really helpful. So that community outreach is been really huge, and trying to meet families where they are. So I've got the weekly produce distributions that I'll be doing, and I have teachers that are volunteering because they hear like, oh, you're going to be out in the community, and it helps them. They're saying, I want to be out there with them. So a couple of teachers here and there will be volunteering to help me do this, so that they can see the families and they can talk to them. And that's what it's about, is meeting those families where they are. Is one of the things that's super important. We want to bump up our dental health. That is a big thing that we talk about with families. There's so much going on in their plate, and there's so much that they need support with, and it just gets kind of lost in that mix of all these worries that they have, that things just don't always get taken care of the way that they know they want to take care of them. They know they need to be taken care of, but sometimes it just gets pushed to the wayside because of all the stress in their lives. And so we're looking at how can we bring in some more dental health clinics. We would like to do it at least maybe a couple times a year. And we're not just talking about cleaning. We're talking about restorative, getting those fillings in, getting those other things that are needed to do, the sealants on the students, those things that, just get pushed to the wayside because it just becomes too much on their plate. So those are some of the things that we would like to see. For our mental health, I forgot to mention that we contract with Pathways and Acadia, and we have their counselors come right into our school, and we have a full-time pathways at each school, at our Old Town Elementary School, our middle school, and our high school. And they come in and they talk and they get to meet with the students that we have referred to them. And so that way, you know, families don't have to, you know, put that extra thing on their plate of how do I get my kid to their counselor. So that's been a huge difference in so many lives. And I'm thinking we could probably add at least 2 more, you know, at every school, full-time counselor, because it is such an issue. Like, there's so much mental health, and we do have waiting lists for students, and it's just, it's amazing that we can at least do that for them. So we did our first ACEs training with our teachers this past spring. And so that was really huge. We had, it was volunteer, because that's the way it ended up having to be set up. And we had such a positive feedback from teachers that they want more, they need more. And so, you know, I'm working with the guidance counselors and at the elementary school and the middle school to see who we would like to be part of a committee, because we took what Sherry was saying about getting that committee together, getting those people together, and really getting all that done. And you know, we're getting those partnerships together in our community school and pulling in those resources and bringing in that support. But we also have to figure out how we can support our teachers too, because they're the ones that get to see these students every day, and they're the ones that essentially are going to be building a lot of this resilience in our students. And so we're talking about trauma-informed classrooms and what they can do on the elementary school level. And so we're working towards that and what teachers want to be a part of that. And at the elementary school level, it's pretty much almost all of them. It's amazing to see that. In the middle school, the huge 6th and 7th grade team was really into some of this idea. So we're going to work this coming year on getting a committee together and getting some teachers together, and how often we can meet and when, because we don't do like here's the in-service day. We get a Tuesday, hour and a half every week. That's how our school is set up, their professional developments in there. And we have so many things that we have to go over in that. So we have to make a time on a different day probably to say, okay, this is going to be our day to meet, and this is when we're going to meet, and these are the things that we're going to do. So that's huge. And I'm really excited for us and our teachers to be able to do that. And we have been overnumbered on students because we had so many new ones come in. So we're adding another guidance counselor next year, which is really exciting to help with some of that load of students that have come in. We're just way overnumbered, and it should help with some of that mental health that's going on and getting those youth needs met. Attendance is something huge that we're working on in the high school, and I finally got it. So we're talking about starting an attendance committee and working on relationships with students in their families, in that capacity of how do we do the outreach, and what can teachers do, and how. And we're going to start that with the freshman and sophomore team. Hopefully next year. We have a thing that we are looking at, and we're tweaking it as we go, and hopefully the teacher input will be helpful and stuff. And then the last thing that I would love to work on is transportation. It's huge. It's an issue throughout the state, and even in Old Town, it is really hard for families to get to point A and point B, and you don't always have money for a taxi, or for whatever reason you can't get there, and that transportation is the biggest issue. And for some of our students that want to work, they can't get to work because they have no transportation, but they have that desire. We have a lot of students that have the desire to work, and they just don't have the transportation to get there. And so we've really talked about how can we do this? How can we get just a bus, to get students from A to B and be able to work and feel like they're doing something for themselves. And it's hard. The families a lot of times that don't come to my resource center when I have my pantry openings, it's because of transportation. So I'm partnering with the church to see what we can do for volunteers and how can we, transport food to the families, and what would that take? And we have to look at confidentiality. What kind of paperwork should we have filled out? Those kinds of things, because next year we want to be able to offer that to families that can't get to the resource center due to transportation issues, but could utilize the food. So those are some of the things. I suggest you check out the communityschools.org. It has a lot of information on community school frameworks. And thank you. I appreciate your time today. Okay.
Great. Thank you, Sherry. And Jennifer for sharing. I'm going to turn it back over to Sue, and Sue's going to share a little bit about the My House data and it measuring protective factors. So you can learn a little bit about that. And what I want to encourage participants to do is to start sending in your questions, and I'll start to kind of organize them. And when Sue is done, we'll open it up and start answering some of those questions. So you can send the questions via chat. And so Sue, I'm going to send it back over to you.
Super, thanks, Joy. So I would like to take us back to the My House. And remember that all you have to do is Google MIYHS, and you can find these data as well as so many other points of data reported by the students, including screen time, how much sleep they're getting at night, how they're feeling in terms of safety, access to drugs, their exercise, just a number of health metrics, health and well-being metrics that are important. So one of my favorite questions in the whole Maine Integrated Youth Health Survey is, in my community, I feel like I matter to people. And mattering is really important because it's belonging. And we're a human species, and we like to belong. And we want to feel part of something that's larger than us. And you can see these data by county. These are middle school data. So you can see that on average, the statewide average is 62 or 63% of the middle school students in the state reported that they feel like they matter in the community. But you can see how that changes based on county, and it has variations across the counties. Mattering is important because it's also linked to aspirations, and it's a critical foundation for building resilience. So the next slide talks about mattering in high school. And again, the same question, in my community, I feel like I matter. And you can see the statewide average is 53%, and counties vary considerably in terms of their mattering score as reported by high school students. And you'll see also in the My House data online, you'll see a variety of ranges. So the low to the high within each one of the metrics that you're looking at, which is also helpful. These data are also available by gender, by age, by grade, by race, ethnicity, and sexuality, and so the LGBTQ population. These are very important data, and I often share these with communities. This is an economic matter, because if our kids don't feel like they matter in their community, the likelihood that they're going to leave when they get out of high school is pretty high. They need to feel like they belong. And so this becomes a workforce development and an economic issue for each of our communities throughout the state. The next slide talks about love and support, the kind of care that we get from our families. And again, this is by county. And so the question is, in my family, I get love and support. And you can see the average statewide is about 88%. And again, this varies considerably. This is middle school data. And if I were working in a community, for example, I live in Piscataquis County, so one of the things I would like to ask about in my community in the at the middle school level is, let's talk to kids and find out what mattering means to them. And for those kids who feel like they matter, what does that feel like and look like? And for those kids who report that they don't feel like they matter, again, what does that feel like, and how could we do better to support those kids within their family structure? What's happening to families? The next slide talks about the same metric, family love and support, at the high school level. And you can see that it does increase at the high school level, which is an interesting conversation that we might want to have at our community level. Continuing on with some of the protective factors, we know that building resilience requires positive relationships, and ideally it is with the families that we live with, because when that happens, those of us external to the family are additive. But when the family, for whatever reason, is not able or available to be there for that child, we become absolutely essential. So the next slide talks about those adult relationships. If we could see that. So if you go back to the middle level, the slide before should be the middle level, where middle level kids were asked to share. The next slide, it should be the next slide, I hope. Yeah. So the question is, I have at least one teacher who really cares about me and supports me when I need it. And so you can see the middle school kids reporting this with the statewide average of about 77%. Remembering that school for many children is the most safe place that they spend a major part of their day. So teachers, faculty, staff, administrators are critical to helping kids feel cared for, supported, and to increase that resiliency that's so important through their relationships with us. The next slide asks the same questions at the high school level, and you can see the average declined to 57%. So what's going on between middle and high school in terms of school relationships? Teachers, I have a school that cares about me, cares about kids, and encourages us. You know, what's going on there? And the best way we're going to find out is by asking the students themselves. The next slide talks about still more metrics of protective factors that help kids to develop, cultivate, and grow their resilience capacity. If we could have the next one. No, I thought there was. Okay, sorry about that. What I would like you to think about is exploring your My House data as a school. Again, you can get your own district or school data through your superintendent or your building principal. And really thinking about, what are these data telling us? Some of this is a little hard to look at. There's a couple of questions in here. For example, in my school, the rules are fairly and consistently implemented. And statewide, about a third of the kids in the state say that that's true. And so in the schools that I've worked with up to this point, that metric really poses a good conversation across the educators to think about, how do we view the rules? Do we all agree on the rules? Do we implement the rules in the same way? Are we giving constant messages to kids that are the same and reinforcing? But there's other provocative exploration that we would encourage you to do. Particularly this slide talks about the ACEs data, but you could take any of the metrics. Screen time is really an interesting metric to look at. We find that only about a third of our children statewide are using screen time less than 8 hours a day. And I think we have to think about that and talk about that, because that's only the screen time that they're on their personal devices. It doesn't include television, and it doesn't include screen time where they're where they're in school and using their computers for educational purposes. So thinking about child age, child grade, ACEs do increase slightly as children proceed through the grades. Thinking about gender, and this is something that we talk about at every school that we work with, girls are far more affected by ACEs than are male kids. And we really need to start talking about that publicly, raising questions about why is this? You know, what can we do to address this pretty significant, as you see, disparity? And you can find these data for all of the metrics that are important to look at. And I would guide you to looking at the depression metric, the suicidal ideation metric, the feeling safe at school, and the bullying, most particularly when we're looking at gender differences. Again, pay attention to the ranges because this can tell you some valuable information that you want. Paying attention to our LGBT student reports as well as the race ethnicity reports, and not just looking at the ACEs information, but also being open and willing to look at many of the other metrics, which will help us to create strong partnerships with families and community members, because schools need to recognize that you are a critical partner in addressing adverse childhood experiences and promoting resilience, but you're not in this alone. We all have a responsibility to work together to improve the outcomes for children and families throughout our state. And again, I want to thank Jen and Sherry for giving so much of their time and their experience of growing their resilience locally as well. Back to you, Joy.
Sorry, I apologize for the delay. My mic takes quite a while to get back in. So we have time right now to take questions. Jessica, can you forward the slide? If you can send them via chat, that's probably the easiest way rather than mics coming on and off. So we'll just wait a few and see if we get any questions in.
I do want to share also, Joy, we should remind people at the end of the PowerPoint are a number of resources that we've provided for them, which are particularly pertinent to public schools in that environment. And also we try to provide materials that range across the pre-K 12 spectrum as well.
Yep. So Jessica just showed the school resources and the community resources. So they are in your PDF packets that got sent to you this morning.
Great.
So any questions?
If there aren't any questions today, the presenters did provide their email addresses as well. So if you do have a question after the presentation or you start doing work at your own school, there are some email addresses also included in the PowerPoint presentation at the end, and you could follow up with them directly.
Yes, and Jessica, I'll just let everybody know that currently Sue and I are doing some trainings around the state during the summer, and most of those you'll see advertised through AdCare. They're a little different than today's webinar, so we do spend a lot of time on what are ACEs, how does it affect brain development, and then what does resilience look like. And so we are doing those, and you can see those listed on AdCare's website. Also, we have another webinar next Friday from noon to 1:30 where we're looking at moving toward resilient communities. So that will be an interesting one to see too, because as Sue said, it's not schools alone and it's not a community alone. It really does take partners working together to address the resilience of not only students, but of the members who live in their communities. And then I just thought I would share that the Maine Resilience Building Network just trained 42 community resilience facilitators, and they are all around the state. And if you're interested in a training, we have right now developed 3 different trainings, a 30-minute training, an hour training, and a 2-hour training on ACEs and resilience. And you can email me. So my email address is themerbentraining@gmail.com if you're interested in learning more about the trainings. But definitely visit maineaces.org. You'll see lots of resources on there, more than Sue provided in the presentation today. And we just want to thank everyone for joining us today.
And we did get one question in talking about the different projects and the work that's happening in schools to address trauma. And the person wanted to hear more about support being provided to the teachers to, help them address their own experience and feelings of burnout.
So thank you for that. Go ahead.
Oh, sorry, it's Sherry. Do you want me not to answer?
No, I want you to answer. You
okay.
Go, girl.
So I talked a little bit about the compassion fatigue that we noticed with our staff, and I don't think we're doing enough. We've talked a lot about having to do more for our staff. That's really, when I'm thinking about my own research, what I'm interested in. We did have a presentation last year, which was awesome, from one of the Merben partners on compassion fatigue. We've talked, and we as a committee have talked about, like, we've used SAMHSAs, and I saw someone had talked about substance use disorder and not substance abuse is the term being used. But from the SAMHSA website, so if you look at the samhsa.gov, which is in the chat box, they also have like an 8 kind of areas of health, and we've gone over that with our staff. I don't think we're doing enough, because I think as we look at our teachers, we're kind of on the front lines, and it's exhausting work, and we're doing even more with less. If you look in your own communities, I'm sure Waterville's not alone in that we're fighting every year even to keep, the teachers and the resources we have. So it's difficult, and I think it's something we all need to talk about. So I guess I'll be quiet now.
No, I think that's very true. Jen, have you talked at all up in your district about teacher support systems, collegial support?
We have talked about it, and just like Sherry said, we haven't done enough. I mean, we've had in the past, we've had a couple people from a few different nonprofits, like Penguins, come in, and they talk with our staff about self-care and things that they can do, and we always let them know, you can come to us and talk to us about anything. We do have one teacher that does yoga with some of our teachers once a week that want to come, and it's come if you want or not, and a lot of the ones that do go say it's just helpful to just relax like that and do those yoga stretches and go through the breathing processes and stuff, and they find it's very de-stressing for them. So it's been nice to have someone on staff that can do that once a week with our staff. But yeah, we don't talk about it enough, and we don't do enough, and that is something that especially on the middle school level, we had a lot of teachers that were very, very stressed. We had new administrative staff this year, which really, when that happens, sometimes it just kind of throws everybody, the teachers and the students, all through a loop, because you're all learning how the different approaches they all have when you're used to an approach from the previous administrative staff. So that was one big thing this year that we're like, we need to get a training in next year for, especially at the middle school, of how to care for yourselves and what we can do, on our level, on the administrative level, to support the teachers a little more and make sure that they are taking care of themselves, and there is a plan in place for when they are feeling overwhelmed.
Right. I think it's really important to identify, there's a lot of opportunity in the school for secondary traumatic stress that teachers experience, that administrators experience, that staff members experience, including the bus drivers, from, the day-to-day exposure to kids and families who are having substantial challenges in their lives. And this can wear on us, and it can cause the burnout. It can cause us to be less than effective because we're feeling pretty overwhelmed and pretty sometimes defeated. So those are important structures to put into place, and it leads to the conversation invariably in school districts about your HR, your human resources, and what are we doing to support people and to prevent the burnout and the disassociation that often happens when people are feeling overwhelmed with challenges, because just as people can be experiencing trauma, so can organizations. And so public schools are sort of ripe for this opportunity, in that they don't have, in that there's always something going on in schools. New change, new additions, new responsibilities, less resource. And it's hard to keep on top of all of that, including the challenges that children invariably bring with them every day into the classroom.